Ayana or Joe, either one of you, is it creating an echo right now when I'm talking?
No.
Sounds good to me.
Okay.
So hi everyone, my name is Ayana Jones. I am a project coordinator with the National Environmental Health Association. I want to thank you all for joining the Health and All Policies approach to lead poisoning prevention at Houston Health Department, the webinar. NEHA, with funding from CDC, National Center for Environmental Health, and in partnership with NCHH, NEHA and ASTHO, is supporting local governmental agencies to implement Health and All Policies strategy as a part of their lead prevention implementation program and activities. The partners choose projects that build and support cross-sectoral relationships, integrate data systems, and incorporate health into a variety of existing decision-making processes. The activities funded will significantly expand the range of models and best practices using a Health and All Policies approach to reduce childhood lead exposure by strengthening linkages of lead-exposed children to recommended services and strengthening target population-based interventions. Today, our grantee, Houston Health Department, is one of our HIAP grantees and will be presenting on their HIAP work with us. I will now turn things over to Joe Miller of NCHH to introduce our speaker.
Thank you, Ayana. This is Joe Miller. I apologize for my voice today. I have a little bit of a cold I'm getting over. It is my pleasure to introduce our presenter from the Houston Health Department, Komal. Komal is again representing the Houston Health Department. She was born and raised in the Houston area. She completed her undergraduate education at Northwestern University, where she studied neurobiology. And she graduated with a Master's of Public Health at Texas A&M University School of Public Health. Komal is currently serving as the project coordinator for the BUILD project and the Health and All Policies and Lead project. These programs are working to improve environmental health with a focus on childhood lead poisoning reduction and asthma trigger abatement. Komal, I hand it over to you.
All right, thank you, Joe, for that wonderful introduction. Hi, everyone. I'm Komal from the Houston Health Department, and today we will be talking about how we use data to implement systems change in Houston communities. So just to give a brief overview of what our presentation is going to be about today, we're going to give a quick background about Houston in general and the programs at our health department. And one program in specifically, which is our BUILD project. So the partnership and approach we did with that project, the two main aspects of lead that we want to focus on, which is lead abatement and lead screenings. So the results, lessons learned, and next steps from that. And then we'll ease into the new initiative we started through the Health and All Policies project in another neighborhood of Houston. So just to give some background about lead poisoning in Houston, we are the fourth most populous city in the US with over 2 million people, over 200,000 of which are children under the age of 6. About 34% of these children live below the poverty level, and almost 60% of homes in Houston were built before 1980. In 2016 alone, there were over 800 children who were screened in Houston who had elevated blood lead levels. Texas is the state with the largest percent of uninsured children in the US. So this just gives some background about the scope of lead poisoning. Some background about us at the health department. The Houston Health Department houses the Bureau of Community and Children's Environmental Health. And through this bureau, we have several programs. We have the CDC-funded Houston Childhood Lead Poisoning Prevention Program, the HUD-funded Lead-Based Paint Hazard Control Program, another CDC-funded program, the Crisis Cooperative Agreement for Hurricane Response pertaining to asthma, and also the BUILD project, Bridging Opportunities in the Near North Side, which is the project we'll be focusing on for our webinar today. So the BUILD project is a collaborative effort, and it's a partnership between 3 organizations. One, the Houston Health Department, which is us, our partner Memorial Hermann, which is the largest hospital system in Houston, and a local community organization, Avenue CDC. So the objective of the BUILD project is that it's a place-based intervention where we're addressing systems change by decreasing lead poisoning through abatement services and lead screenings, increasing community engagement, and increasing community capacity in the neighborhood through innovative partnerships. It's a twofold opportunity. So as I mentioned, one of the projects or programs we did under the project was lead abatement. So we mobilized community residents supported by local organizations to identify lead risk at the street level, leading to abatement services. And we accelerated systems change and process change by introducing lead screenings at the local WIC, as well as conducting screenings in daycares and for the population attending the Houston Independent School District. So the target community as part of the BUILD project was the Near North Side neighborhood of Houston. Just to give an overview, it's an environmentally overburdened community. It is multi-generational, so families have been living in the same community for many, many years. It is primarily a working class population and a Hispanic population in the community. And it is also a known risk area, a high risk area for lead poisoning. So we at the health department used existing data systems to help identify the neighborhood. And we found that 92% of homes are at risk for having lead-based paint. Over 25% of children that were screened between 1996 to 2016 had blood lead levels above the CDC reference value. And the rates of confirmed blood lead levels above reference value is 4 times higher in the Near North Side than it is for the rest of Houston as a whole. So the approach we took for this project is really to engage the community. So the Near North Side already had a strong history of civic engagement. So the health department worked with existing resident teams known as block captains that were mobilized in part with our partner Avenue CDC. And we trained these block captains on how to identify visual indicators of lead-based paint, and also basic eligibility criteria for how to refer these neighbors to our lead abatement program. So it really became a system of neighbors referring neighbors to help their neighborhood become lead safe. And it was through partnerships with Avenue and CDC and other community leaders that really helped bolster our efforts in advertising and presenting our efforts at local churches, schools, businesses, and civic clubs in the Near North Side. So as part of the project, we at the health department developed a lead risk map, and we used data from the Harris County Appraisal District to identify homes at a parcel level that were at risk of having lead-based paint. So essentially homes that were built before 1978. And we mapped it out to kind of highlight areas where there's a larger proportion of homes that are at risk of having lead-based paint. And this map really helped to guide the block captains in focusing their efforts for recruiting homes for abatement. And as you can see, this is kind of a zoomed in version of that map. The areas that are pink are homes that are at risk of having lead-based paint. The homes that are highlighted in green are homes that we have previously abated through our lead-based paint hazard control program. And these yellow triangles that you see clustered, those are homes that were referred to our program by these neighborhood block captains. So you can really see that the community residents really took ownership of this project and went out and, tried to recruit homes, educate their neighbors, and refer homes for abatement. So since October of 2017, when we started this process, over 150 homes were referred by community block captains for abatement. Over 400 other homes were referred by other community organizations and community members. And 18 of these homes have been qualified for our program. Block captains and Avenue CDC specifically worked together to develop a referral system that involved block walking and canvassing of the neighborhood. And they also involved the local police department to bolster these efforts. The health department created a shared address database to track these referrals at the point of referral rather than the point of qualification for abatement services. So this process started in October 2017, but is still an ongoing effort in the community. Just recently, in February of this year, Avenue CDC collaborated with a local elementary school to organize a community block walk in which all of the teachers and staff from that community or from that elementary school were given this training on how to identify lead-based paint and refer homes. And then they went out and canvassed the streets and blocks surrounding the school to talk to homeowners and families, educate them about lead, and let them know about resources and refer them to our abatement services. So this is kind of an overarching analysis of the status of all the referrals we've received. As you can see, it shows a breakdown of the various statuses. So about 278 homes that were referred did not have any lead. 175 of the homes needed an external contractor. 18 homes were qualified. 19 homes required service or resource matching for other issues in the home that needed to be addressed prior to lead abatement. And 55 homes needed further community engagement. And we're gonna kind of walk through each of these separately. So for the homes that did not have any lead, did not show signs of lead-based paint, 180 had no lead-based paint hazards. 59 of these homes were not built pre-1978, so they were not targeted housing. 25 of these homes had either been demolished or were now empty lots, and 14 of the homes actually had latex paint. For the homes that require further resource or service matching, these again are homes that needed had other issues that needed to be addressed prior to abatement. So 10 had unsound structures, 5 had unsound roofs, 2 had unsound foundations, 1 had unsound electrical wiring, and 1 had been tagged for code enforcement. The split for homes that require further community engagement, 31 of the homes that had been referred did not give further response to any of our phone calls or door hangers we left. 5 homes failed to provide all of the required information that's needed to qualify for the program. 4 are still pending that qualification information. 14 homes, the owner withdrew sometime in the middle of the process. And similarly, for 1 home, the renter withdrew. And then for the homes that needed an external contractor for various reasons, 98 of the homes had lead-based paint, but the paint was still intact. 44 were commercial properties. There were 11 that were over income limits, and 18 where there was no child under 6 or pregnant women either visiting or in residence. And then a few were because it was either under construction, for sale, the homeowner moved out, or it was more than a 4 multi-unit property. So to recap, some of the challenges that we faced during this lead abatement process, a lack of funding to solve all of the problems that a home might be having prior to being able to abate the house, or being able to find resources for homes that were unable to qualify for our program. But we also did have several highlights and successes. One big one being in April of 2018, last year, Secretary Carson from HUD came to Houston as part of a HUD pilot event in which the Houston Mayor, City Council, the Director of our Health Department, and other local leaders were kind of taught up about lead poisoning prevention and resources for lead poisoning. And so that was a really big event for us. And we've also noticed a large increase in the number of community champions in the community who are now aware about lead poisoning and strategies for prevention, and also the development of this address tracking database for all the homes that we are getting referred to our program. So these are just a couple of photos from the HUD event with Secretary Carson last year. And, oh, sorry. Just need to go back a couple of slides. Sorry about that. So the other program, now switching gears, we talked about lead abatement. Now we want to talk about the lead screenings that we did as part of the BUILD project in the community. So we began implementing screenings on a smaller scale at daycares, schools, and community events to increase the screening rate in the community and also build that awareness amongst residents. So our partners, Avenue CDC and Memorial Hermann, were pivotal in referring community organizations who are interested in events to our bureau in which we could provide the lead screenings. And once invited, we would host tables at these events and daycares to educate parents and families, collect consent forms, and then conduct the screenings. And eventually this process led to us being able to train the WIC and immunization staff at the local clinic in the near north side to provide lead screenings. So just a couple, again, photos of us conducting lead screenings in the community. And just like a summary of the data we've collected since we've began implementing screenings. We have conducted lead screenings at 25 community events and health fairs since June 2018. And in this past year, we have screened 161 children at these community events. And we found 14.9% of children screened had blood lead levels above the reference value. From this data that we collected at community health fairs, we were able to push process change to begin implement screenings at WIC. So WIC nurses began conducting lead screenings in October of 2018. Then they have done screenings for 330 children and 100 pregnant women. And they find 2.2% of the population screened had blood lead levels above reference value. Our initial data from the past year shows that there's been about 50 screenings per month since June. And it's interesting to note that 80% of the population screened were first-time screeners. So it's really important to continue screening in the community and raise that awareness and screening rates. So again, lessons learned from our lead screening initiative. We have had some challenges in that we have seen low return rates for consent forms. Sometimes there are limitations in facilities that limit our ability to provide the lead screening, such as not having facilities for hand washing prior to screening, and challenges coordinating with organizations to conduct the screenings. But again, on the flip side, we have had highlights. there has been an increased community knowledge of lead exposures and the importance of getting your child screened. There is increased awareness and engagement in our leadership in the city. And we were able to implement lead screenings at WIC after 10 years of efforts to do so. So our next steps with both of these programs, for the lead abatement, we hope to improve and expand our address database and also improve our resources for referrals that were not able to qualify for our program. And we would like to scale this approach to other communities in Houston beyond the near north side. And then on the lead screening end, we're looking to explore reimbursement opportunities for our lead screenings. We would like to scale to other WIC sites and communities, and we would like to find sources where we can, sources for sustainable funding. So that kind of eases us into the new initiative we started as part of the Health in All Policies grant, in which we are now working in another community of Houston, the 5th Ward. So about a brief background about the 5th Ward community. It is a neighborhood adjacent to the near north side, so it is similarly environmentally overburdened. Also a predominantly working class population, but in contrast to the near north side, this is a community that is predominantly African American. Almost 40% of the population lives below the poverty line, so it is a community really in need. And again, it is a known high lead risk area. So similar to how we did it in the near north side, we used our data systems, and we found that about 75% of homes are at risk of lead-based paint. There have been elevated blood lead level rates as high as 51% in the past. And in recent years, 3 to 6% of screened children have been showing elevated blood lead levels. So the approach we took for this project is scaling and replicating of the successful strategies we saw in the near north side build pilot intervention. So the health department, in partnership with local 5th Ward organizations, are working to identify and mobilize resident teams, so forming block captains again in this neighborhood, to train these block captains on, again, visual indicators of lead paint, basic eligibility criteria for our abatement program, and how to refer these homes to our abatement. And we're doing so through a series of train the trainer workshops. And local 5th Ward organizations and community leaders have been pivotal in helping us, helping our efforts by advertising again at schools, churches, businesses, to let residents know of this opportunity. So we developed a similar lead risk map for the 5th Ward community, again, using data from the Harris County Appraisal District to identify homes at a parcel level that are at risk of having lead-based paint. Again, the areas in pink you see are areas that are, or homes that are at risk of having lead-based paint. Green are homes that we have previously abated through our program. And so there are over 10,000, almost 11,000 properties in the 5th Ward, and over 4,000 of these residential properties are at risk of having lead-based paint. So of a total of about 5,000 residential properties, over 4,000 are at risk. And we, through our lead-based paint control program, have made 185 homes lead safe in previous years. So our goals for the community and for the project are to increase referrals to our lead-based paint abatement program, increase community capacity and knowledge about childhood lead poisoning prevention strategies, increase rates of childhood lead screening, and improve access to resources and follow-up services. So to that end, in the past 6 months, we have built partnerships with local Fifth Ward organizations, such as the Fifth Ward Community Redevelopment Corporation, Fifth Ward CRC, Go Neighborhoods, a few other local churches, to recruit residents, identify block captains, and promote the trainings. So we have provided 7 trainings as part of this project. We have recruited about 11 block captains who are really passionate about improving the health of their community. And we have already begun receiving referrals to our lead-based paint abatement program as part of this process. So we will continue on with our efforts even beyond the project, but that is how that's kind of how we've been doing so far. So that was it on our end for the presentation, but now if anyone has any questions, we would be happy to address them.
And so you are welcome to type your questions in the chat box, or you can speak and talk to ask your question. So I have a question. Komal, thank you so much for that presentation. That was awesome. I wanted to ask, how are block captains trained? And then do you all use a specific curriculum, or did you all create your own curriculum to train them?
So that's a great question. We actually kind of created our own curriculum for training. So we worked together with our inspectors from our lead-based paint program. We worked with our inspector and qualifier to create a presentation where we kind of show pictures and describe how to identify signs of lead-based paint and the basic eligibility requirements for being able to qualify for our program. And what we did was when we hosted one of these workshops, we would give the presentation and any questions that the residents had, we would try to address to the best of our ability. And then the block captains were recruited. They're essentially community volunteers. So these are individuals who are just really passionate about improving the health of their community. So they would volunteer to kind of take ownership of a particular block or streets in their neighborhood. And from the training we give them, they work with us. They're kind of like our point of contact between us and the community. So they work with us to kind of connect with homes that might be good candidates for abatement. And so essentially, yeah, they're trained through a presentation that we put together.
And is it possible for you to share that curriculum with us?
This is Kavya from Houston. We can share the presentation, but it's exclusively based on our HUD guidelines, what we said. So it might not be the same guidelines that your organization follows, but we could share it.
Okay, thank you.
And one thing that I should have mentioned earlier, actually, is one of our community partners, LISC, was really great in connecting us to a resource that the block captains are using to refer homes. and that is what's called the IRIS application. It's essentially a mobile application that is used to provide surveys on properties. So LISC was able to connect us to them, and we developed our own lead abatement survey, which is essentially, it's a very short survey, about 5 questions asking, basic criteria. Was the home built pre-78? Are there children under the age of 6 or pregnant women in residence? Are there signs of peeling, flaking, chipping lead paint? And so the block captains can use this application and just electronically upload all the answers, and then that's sent to us as a referral. So that way we know whether or not a home can meet some of our basic eligibility criteria.
That's amazing. And actually, how did you all recruit to get volunteers for the block captains?
So one of our project members, she is our community relations specialist, and she would go out in the community, meet with local organizations, so local churches, local civic clubs, just other community organizations, and explain our project, the importance of lead poisoning prevention. And through collaboration with these organizations, we would advertise for these workshops, and through word of mouth, through people that they already knew of that might be interested, they help spread the word. And really that's how we got a lot of our recruitment in collaboration with these organizations.
Thanks for sharing that.
Komal, could you share with the group if you work with home building and repair nonprofits like Habitat or local volunteer organizations that do home repairs?
Like we were mentioning earlier, this is Kavya again. With Avenue CDC, it is a local community development program, and they do a lot of fundraising, and they get a lot of donations to do some of these repairs. So we work closely with them. We also work with Rebuild Together Houston. Most of the time, they donate paint and the supplies required for the project, but not necessarily work on our project. We do work with, Avenue does work closely with Habitat, not necessarily the health department, but we do collaborate with them on some projects. But our major source would be, even the CRC and Go Neighborhood, they are community development organizations, so they do have some funding and resources to address some of the non-lead issues when we do get referrals. So we work closely with those community groups and community development groups within their own community.
Thank you. Yeah, that does. We have another question from Claudia, and it says, how do you plan to sustain this model?
So like Komal mentioned in her presentation, actually we engage the community. So when the community is engaged and they're vested, these are volunteer block captains. We don't pay them to do the work. So they genuinely want the community to be healthy and reduce the environmental burden in their community. So these community groups are active, and the block captains are active. So they continue providing us the support, and they organize work groups for us to go out and train. So it has been purely volunteer organization. I guess you could say like Houston has been lucky in this case, but it's mostly volunteer basis. So that's how it's sustainable. In the presentation, Komal, even though we are not working so much in near north side, still the groups that we have trained, they are still engaging the community. They are coordinating more trainings, calling us to say if we are available to provide training. So that's how I think the momentum remained, and people understand the risks of lead. The community is well educated on lead risk right now. That's what we are seeing in near north side, and we hope to see the same in the 5th ward. I hope I answered the question.
You did. You did. It's wonderful.
I have another question. Kavya and Kamal, do you all use some type of specific software for your database?
Yeah, so it's not a specific software. Basically, we created our own Excel workbook, and it kind of has, you know, the basic information, demographics, and whatnot. But we also set it up in a way that, based off the findings of our qualifier, it will auto populate next steps or primary recommendations based off the findings. So, for example, if we see a house that might have an unsound foundation, once we enter in the finding, the worksheet will automatically auto-populate to say that this house needs resource matching. And that way we keep track of all the homes that have been referred, but also like which homes need resource matching, or which homes need further community engagement. So that's kind of how we've been keeping track. It's not a specific software. It's just the way we've set up our Excel workbook.
But we do use the software that our community agent. It is a software because all the block captains will have access to it.
The IRIS application.
The IRIS application. So it does document at a address level, like what are the risks in that unit, whether it's chipping, flaking paint, but it doesn't have extensive information like how Komal was mentioning in the Excel sheet, where we also, like once you put your finding, it just populates whether it's a qualified person or whether it needs resource matching, whether it has unsound, something external work needs to be done. So we do have those two applications that we use right now.
I have another question. You know, you touched on both that you're dealing with the housing and lead poisoning, which is wonderful. We can get health and housing working together and we can address both. But I want you to talk a little bit maybe about any clinical services that you provide or how you do case management.
We do work closely with the HISD nurses right now, and also the wraparound facilitator, who are kind of like associated with they are in touch with the nurses in the HISD and the children. So the wraparound facilitator communicates with the parent if we need additional resources for the parent. That's the way we are using this 6 census tract in the north side, so it's pretty close-knit community, and the schools and the wraparound facilitator, the school nurse and the parents, they do communicate closely. So that's one way of us doing it. We also provide some case coordination with our childhood lead poisoning prevention program, but that's only limited to children who are above reference value at this point. For other resources, we do go back to the school nurse and the wraparound facilitator in the schools.
And if they're not working with the schools, if they're not in the schools, how does that happen if they're too young to be, if they're not school aged?
So we do use some of our community organizations to help with those resources. Like Avenue has a community health worker group that they work with, so we go to them to get some of those additional help. So our community groups have been really helpful in identifying additional resources for these projects. So they're really vested in the benefit of the community.
Excellent. You have such a great model, and I love that you're duplicating that, you know, kind of wraparound service and focusing on these communities and helping to use the resources and the connections that are already there to help it kind of empower the community to do this work. I love it.
Yeah, the whole vision of our leadership is that's what we want it to be, a sustainable project. If we go out and do it, then it's always coming back to us. And like the limited resources and limited funding, we want to empower the community to kind of handle, like create their own resource system where they can reach out to each other to address most of the issues. And we would be there to give them, train them, guide them, and help them identify these resources.
That's great. And so, you're reaching out to the community, you're engaging the community. The other part of that is sometimes we need to have enforcement involved too. If we can't protect the kids, or we have a property owner, maybe that a rental property owner that isn't part of the community, do you have a good local lead ordinance that supports this work?
Okay, that's kind of via Texas, right? So we are working towards it. We did develop a draft lead ordinance, and we are in the process of presenting to our mayor. Unfortunately, this year is an election year, so maybe early next year we would kind of go on full swing. But our leadership has been enlightened in a big way with the HUD event, Dr. Carson, Secretary Carson being here. And like lead is in everybody's mind at this point. Even housing, even though we do receive matching funds from housing, they are coming back to us and they're saying, do you need additional resources? How can we help in other external resources that this near and outside neighborhood needs? So there's a lot of momentum going on right now. So we are hoping sometime next year we would tell the federal agencies that, oh, Houston has a lead ordinance now, which could enforce a lot of these things.
Wonderful.
We have one question from Claudia. Looks like Claudia sent another question.
Okay.
She says, can you talk about how you will leverage your work to increase funding?
That's. I think I did answer that question a little bit.
Okay.
Are working with housing community housing and community development group. The lead-based pain program in Houston resides in the health department. So we do partner with our housing community and development, which do a lot of home improvements. So we are partnering with them to address some of these issues, and also like Rebuild Together supports us. Avenue CDC, which is a community development organization, and the Fifth Ward CRC, which is a community development organization. They have resources to address these external other than lead, and we use lead monies to address the lead issues in these homes, and these agencies, the community partners, use to address non-lead in these houses. So that's how we are trying to leverage resources right now.
Thank you. Are there any more questions for Kavya or Komal? And this presentation will be shared. We're going to share the recording and some of the resources in the presentation with you all in a follow-up email.
And any other questions after the presentation, definitely forward it to Laura, or you can directly contact Komal or me.
Yes. Their contact information will be at the bottom of the presentation, or you could grab it here, or you could, again, reach out to either Laura or Dr. Sandra Whitehead if you have any other questions. So with that being said, we're going to go ahead and wrap it up. Thank you so much Houston Department of Health. We appreciate you all presenting on your work and your continued efforts to address lead prevention in Houston. And so again, we'll be following up with you all of the attendees with both an evaluation, the webinar link, and the resources that Komal mentioned in her presentation. Joe, did you have any last words?
I just wanted to thank you guys for hosting this, and thank you to the Houston Health Department for all the work that you're doing and for sharing your success and your challenges with us so that we can all learn together.
Thank you so much for letting us present.
Yes, we're really thankful for you guys giving us the opportunity to be able to share our work. So thank you.
Absolutely. Well, take care, everybody. Have a good one.
Bye-bye.